What if the position you sleep in tonight is quietly strangling blood flow to your brain while you rest? Not dramatically. Not with warning signs. Just silently, night after night, building pressure in vessels that were never designed to absorb it for 7 or 8 hours straight. Here is the number that should stop you cold. 30% of all strokes happen between midnight and 6 in the morning. Not during exercise. Not during stress. Not during any of the moments you have been warned to watch for. During sleep. During the hours your body is supposed to be recovering. And the research is now clear on something that almost no standard medical appointment ever covers. The position your body is in during those hours directly affects blood flow, oxygen delivery, intracranial pressure, and your brain's ability to clear the toxic proteins that accumulate every single day. It is not a minor detail. It is one of the most consequential health variables in your life, and you have complete control over it starting tonight. Before we go any further, drop a comment right now and tell me which kind of sleeper you are. Back sleeper. Side sleeper. Stomach sleeper. Because in the next few minutes I am going to tell you whether your habit is on the danger list. And if you are over 60, what I am about to share is not optional information. It is protection you deserve to have. Stay through the entire video because the two positions that actively protect your brain and your heart are at the end, and the specific details of how to execute them correctly are the part most people never hear. And if this channel is where you want to keep receiving the medical information your standard appointments never cover, subscribe right now and turn on the notification bell. Every week we deliver exactly this. Now let us get into it. Position 5, sleeping completely flat on your back with zero elevation. This is the one most people assume is the safest position because it feels neutral. The spine is straight. Nothing is being compressed. It seems logical. Here is what is actually happening when you lie completely horizontal, especially after 60. Blood pools toward your head. Gravity is no longer working for you. It is working against you. In your 20s your blood vessels are flexible enough to manage this redistribution without difficulty. After 60 those vessels have stiffened. The tiny arteries in your brain have become more fragile. And when blood pools in your head for 7 to 8 uninterrupted hours the pressure inside your skull builds progressively. That headache you wake up with at 3 in the morning that you have been attributing to stress or dehydration or poor sleep quality. That is intracranial pressure. Your brain is being squeezed by excess blood volume that cannot drain properly because gravity is delivering blood toward your head and nothing is helping it return. Research published in the Journal of Clinical Sleep Medicine studied this exact phenomenon. What they found was striking. Even a 15-degree elevation of the head significantly reduces this pressure and improves blood flow returning to the heart. A 15-degree change. That is less than the height of a standard wedge pillow. The dizziness many people experience when they sit up too fast in the morning is not simply a sign of getting older. It is a warning signal that blood flow dynamics during sleep are not functioning correctly. The body spent hours managing a pooling problem and the cardiovascular system is struggling to rebalance when you suddenly change position. The fix is straightforward and I will give you the exact method at the end. But first you need to understand position 4 because this one surprises people every time. Position 4, sleeping on your right side with any history of heart issues or high blood pressure. This sounds oddly specific. It is. And the specificity is the point. Your heart sits slightly left of center in your chest. This is not a minor anatomical detail, it determines how your body responds to sleeping on each side. When you lie on your right side your body weight shifts in a direction that places mild compression on the inferior vena cava, one of the largest veins in your body, responsible for returning blood from your entire lower body back to your heart. Even mild compression of this vessel means your heart has to work harder to pull that blood back in. It has to generate more force with every single beat to overcome the resistance created by your own body weight. For a healthy 30-year-old this is a manageable additional workload. For someone over 60 whose heart is already compensating for arterial stiffness, borderline blood pressure, or early-stage cardiovascular changes, adding 7 hours of increased cardiac workload every single night is cumulative stress that does not show up in a daytime blood pressure reading. It shows up in how the cardiovascular system performs at 3 in the morning when demand spikes and the heart is already fatigued. The European Journal of Heart Failure studied sleep positions in cardiac patients and found that left-side sleeping was consistently associated with better blood flow stability and measurably less strain on the heart during the overnight hours. There is also a telling clinical observation. Patients with heart failure instinctively avoid sleeping on their right side. They report discomfort. They shift without knowing why. That is the body communicating clearly. This position is creating a load the heart is struggling to manage. If you identified yourself as a right-side sleeper in the comments, position 3 may apply to you as well. Keep reading. Position 3, sleeping with 2, 3, or 4 pillows stacked under your head. This is one of the most common sleep habits among adults over 60 and one of the least understood sources of morning symptoms. People stack pillows thinking it helps with breathing, acid reflux, sinus drainage, or simply because it feels more comfortable. Some elevation does help, and we will cover the correct amount at the end. But excessive elevation through stacked pillows creates a specific problem that has nothing to do with height and everything to do with angle. When your head is propped too high by stacked pillows, your neck is not simply elevated, it is bent forward. Sometimes dramatically. And running along both sides of your cervical spine are the vertebral arteries. These are the vessels responsible for supplying blood to your brainstem, your cerebellum, the regions of your brain that govern balance, coordination, and basic consciousness. When your neck is forced into sustained forward flexion, those arteries experience compression. Not acutely enough to cause immediate symptoms, but chronically enough, over months and years of nightly compression, to reduce oxygen delivery to these vital brain regions in ways that accumulate silently. The Journal of Manipulative and Physiological Therapeutics examined how neck position affects vertebral artery blood flow and found that extreme forward bending measurably reduced flow through these vessels. If your neck is in a compromised angle for 8 hours every night, the cumulative effect is not negligible. The most telling indicator is this: if you wake up with neck pain and a dull ache at the base of your skull regularly, and if that pain disappears within a week of switching to a single properly contoured pillow, the stacked pillows were restricting vertebral artery blood flow throughout your sleep. That is not muscle tension. That is reduced circulation to your brainstem. One correctly sized pillow. That is the intervention. But position 2 is where the concern becomes serious. Position 2, sleeping in a tightly curled fetal position. This is one of the most instinctive sleep postures, especially for older adults. It feels protective. Safe. The body curls inward, the knees come toward the chest, the chin tucks down. It mimics a position of comfort. From a physiological standpoint, it creates two serious problems simultaneously. The first is respiratory. When you curl tightly with your knees pulled toward your chest and your chin tucked downward, your rib cage compresses. The physical space available for your lungs to expand is reduced. Every breath you take throughout the night is shallower than it should be. Not dramatically shallower, just chronically, consistently shallower. When oxygen intake drops even 10 to 15% over an entire night, your blood oxygen saturation decreases. For someone with any degree of cardiovascular compromise or early respiratory changes, this reduced oxygenation places stress on both the heart and the brain simultaneously, across hundreds and hundreds of breaths. Research in respiratory physiology and neurobiology demonstrated that body positions involving significant spinal flexion measurably reduced tidal volume, the amount of air inhaled per breath, throughout sleep. Across an entire night, that adds up to a substantial cumulative oxygen deficit that the body is trying to compensate for while simultaneously trying to repair and recover. The second problem is circulatory. In a tightly curled position, the muscles of the neck and upper back remain under sustained tension. Small blood vessels around the cervical spine and at the base of the skull experience compression throughout the night. Blood flow to the brain decreases not from a single significant event but from hours of mild sustained restriction. The morning fog, the dull headache, the feeling of having slept without having rested, these are frequently the symptoms of a brain that spent the night mildly oxygen deprived, not from any dramatic cause but from a body curled in a position that made recovery physiologically harder than it needed to be. Position 1, going to bed within 2 hours of a large meal or any alcohol. This is not technically a sleep position. It is the habit that makes every sleep position more dangerous. And it is the most common high-risk sleep behavior among adults over 60. Here is the cardiovascular reality of what happens when you eat a large meal and go to bed within 2 hours. When you eat, your body redirects a significant volume of blood to the digestive system to manage the processing and absorption of food. This is normal and necessary. But it means that blood is being redistributed away from the brain, the heart, and other vital organs during a period when the cardiovascular system is simultaneously beginning to slow its output for sleep. In younger adults with flexible vessels and strong cardiac output, the body compensates for this redistribution without difficulty. In older adults with arterial stiffness, reduced cardiac reserve, or any degree of plaque buildup, this redistribution can produce dizziness, lightheadedness, and in vulnerable individuals can temporarily compromise cerebral blood flow during the early stages of sleep. Now add alcohol to that equation. Alcohol is a vasodilator. It causes blood vessels to relax and widen. Blood pressure drops. This feels relaxing, and in controlled circumstances it is physiologically benign. But in an older adult with stiffened arteries, the sudden drop in blood pressure triggered by alcohol close to bedtime provokes a compensatory response. The body tries to correct the drop. Blood pressure spikes. Then drops again as the alcohol continues to act. These oscillations, pressure up, pressure down, up again, down again, stress vascular walls. In vessels that already carry the burden of decades of cardiovascular workload, these fluctuations are not benign. The American Journal of Hypertension studied alcohol consumption and nighttime blood pressure in detail. Even moderate alcohol consumed close to bedtime consistently disrupted the normal blood pressure dip that should occur during sleep. That natural nocturnal dip is not incidental, it is a critical period during which the cardiovascular system recovers. When it does not occur, cardiac strain continues uninterrupted through the night. The intervention is specific and actionable. Finish dinner a minimum of 3 hours before bed. If you consume alcohol, stop a minimum of 4 to 5 hours before sleep. After dinner, walk for 15 minutes. Gentle movement accelerates gastric emptying, stabilizes post-meal blood pressure, and signals the cardiovascular system that the digestive demand is resolving before sleep begins. This single habit change, finishing dinner 3 hours before bed and walking afterward, can reduce overnight cardiovascular risk more meaningfully than most people realize. And it costs nothing. Now you know what to stop doing. Here is what to do instead. Protective position 1, left side sleeping. Your heart sits slightly left of center in your chest. When you sleep on your left side, gravity assists blood flow rather than fighting it. Your heart works less to circulate blood. Blood returns from the lower body more efficiently. Your brain receives better oxygenated circulation throughout the night. That is the basic cardiovascular rationale. But here is the discovery that changes the entire conversation about sleep position. Approximately a decade ago, researchers identified what is called the glymphatic system. Think of it as your brain's overnight waste disposal infrastructure. While you sleep, specifically during deep sleep stages, this system flushes metabolic waste, toxins, and proteins from brain tissue. Among the proteins it clears are amyloid beta and tau, the same proteins whose accumulation in brain tissue is directly associated with Alzheimer's disease and cognitive decline. A study published in the Journal of Neuroscience found that the glymphatic system functions most efficiently when you sleep on your side, and specifically that left-side sleeping appears to optimize this waste clearance process. Here is why this matters beyond stroke prevention. Every day your brain accumulates metabolic byproducts from its normal activity. In a healthy brain, the glymphatic system clears these byproducts during sleep. In a brain where sleep position is chronically restricting glymphatic efficiency, those proteins begin accumulating. Not overnight. Not in a week. Over years. Over decades. By the time symptoms of cognitive decline appear, the accumulation has been building for a long time. Left-side sleeping is not just about protecting your heart tonight. It is about protecting your cognitive function 20 years from now. Additional benefit: If you deal with acid reflux, the anatomy of your stomach and esophagus means left-side sleeping keeps stomach acid below the esophageal junction. Reflux decreases. Sleep quality improves. Morning chest burning reduces. Protective position 2, back sleeping with gradual elevation. Not flat. Not seated. A gentle incline, raising your upper body 15 to 30 degrees from horizontal. This can be achieved with a wedge pillow, an adjustable bed frame, or carefully arranged standard pillows that elevate the entire upper body rather than just the head. The critical distinction is that the entire upper body elevates along a gradual incline, not just the head being propped up while the torso remains flat. 3 specific mechanisms make this position therapeutically valuable. Important clinical note: this position is not appropriate for everyone. Severe sleep apnea may require side sleeping rather than back sleeping regardless of elevation. Specific shoulder or hip conditions may make one position more appropriate than another. Understand the principle, the mechanisms at work, and apply it to your specific situation in conversation with your healthcare provider. Tracking your overnight health: what your body is telling you while you sleep. Your body provides data during sleep that most people never access because nobody told them to look for it. An overnight pulse oximeter, a small device that clips to your finger and tracks oxygen saturation throughout the night, can reveal whether your oxygen levels are dropping below 92% during sleep. Repeated drops below that threshold indicate sleep apnea, poor circulation, or respiratory compromise, all of which increase stroke risk and all of which respond to intervention. The data this device provides is directly useful in a conversation with your physician about overnight oxygen management. Heart rate variability tracking through a wearable device, smartwatch or sleep ring, measures how well your autonomic nervous system is functioning overnight. Low heart rate variability during sleep is associated with elevated cardiovascular stress, inflammation, blood pressure dysregulation, and impaired recovery. It is an early warning indicator that your body is not recovering during sleep the way it should be. You do not need a prescription to change your sleep position. You do not need a medical procedure to elevate your upper body 15 degrees. You do not need anything beyond the awareness you now have and 1 or 2 targeted adjustments made tonight. Here is exactly what I want you to do before you go to sleep tonight. Pick one change. Just one. Switch to left side sleeping with a body pillow for support. Elevate your upper body 15 degrees with a wedge pillow. Finish dinner 3 hours before bed instead of 2. Replace your stacked pillows with a single cervical contour pillow. Any one of these changes made consistently for 7 days will produce a measurable difference in how you feel when you wake up. Pay attention to your mornings. Notice whether headaches decrease. Notice whether the morning dizziness reduces. Notice whether you wake with more mental clarity and less of that heavy foggy feeling that has become your baseline. Your body will tell you whether the change is working. Drop a comment right now and tell me which position you are starting with tonight. Left side sleeping or elevated back. Your answer helps other people in this community recognize patterns they have not yet connected to their sleep habits. Every comment is read and every answer matters to someone else watching this video who has not yet commented. Share this video with one person tonight. One person over 60 whose morning symptoms, the headaches, the dizziness, the fog, the neck pain, have never been connected to what their body is doing for 8 hours every night. You have information now that most people never receive in a standard appointment. Passing it on costs you 30 seconds and could change someone's health trajectory. And subscribe right now, turn on the notification bell, because next week we are covering 5 specific foods that clinical research shows can reduce stroke risk by up to 30%. Not general dietary advice. Specific foods, specific preparation methods, specific amounts. Information that will not come up in a standard appointment but that could genuinely change your cardiovascular risk profile starting with your next grocery run. Hit subscribe. Turn on the bell. Sleep on your left side tonight. Your brain has been working for you every minute of every day without asking for anything in return. Give it the position it needs to repair itself while you rest. That starts tonight.